The thing that you have to understand about a robot is this robot has not got a mind of its own. It doesn't think, it doesn't have cognitive function. It does what the surgeon wants it to do, and it responds to commands by hand. Basically, the system has got a camera system with 42 lenses. It gives you a fantastic 3D picture, and it works in confined space. The main issue is vision in a confined space. When you do a radical prostatectomy, you have a lot of vascular structures around it, your dorsal venous complex, which bleeds easily. So you see a magnified vision, about 10 times of that, with precision needle placing. That precision allows you to anastomose the bladder neck to the urethra with a continuous suture. So you get a watertight suture. The rollout and the expenses has been shown to increase in prostate cancer treatment in America. You et al. Did a study in 2009. They reviewed the cases from 2003 to 2007, and they said there was no improvement in outcomes when you compare robotic radical prostatectomies versus open radical prostatectomies. Gondaglia did a meta-analysis of the robotic radical prostatectomies in 2008 to 2009. They showed that there was no difference in the rate of complications and rehospitalization between open surgery and robotic surgery, but that there was a difference in the reasons why patients were admitted. So with the robot, you get a new set of complications that you're going to see in the future, and you've got to get used to and look out for. It's not the same as open surgery. But they also showed there's a 4 times less chance of getting a blood transfusion. At least 50%. At least. It's probably quite a bit less. 50% less time in hospital. Some guys will send their patients home the next day. They've got lower positive margins, especially for T2, organ-confined disease. You get a higher cure rate with a robot versus open. Similar rate of adjuvant therapy afterwards. Again, they showed that there was a higher cost to society to treat prostate cancer with a robot. There are people that want to say that changes over the year. I think that's mostly biased. Our conclusion is that it is expensive, but there's reasons why you want a robotic radical prostatectomy. They made no conclusion whether there's improvement in continence rate and erectile dysfunction rates. Since 2009, there's been plenty of single institution studies comparing open and laparoscopic radical prostatectomies versus robotic radical prostatectomies. And there's a strong bias, and you'll need a proper meta-analysis again that shows that there's improvement in continence and that 86% of your patients are continent at 3 months after robotic surgery. The most important factors in determining continence is a nerve-sparing procedure, which means it's precision dissection of the prostate, which helps continence, and the age of the patient, the younger, the better chance. So, as far as erectile dysfunction, studies show about 77% of men have their erections back at 1 year versus 32% with open surgery. I think this is a bias again. Your figure that is generally accepted is about 50% erectile dysfunction back with open surgery. But there's a difference as in the time it takes for a man to return to normal intercourse, and that's clearly advanced with the robot. Post-operative sick leave, and you can see that's part of the sick leave, at least 50% less time spent after operation on sick leave compared to open surgery. We're lucky and we're really fortunate that we got it here. A lot of urologists are involved mainly because at the moment they're the only speciality that's got medical aid approval for these procedures. And it was the startup of all this type of surgery all over the world. So in the end, it's going to be a couple of people that do it, and people will probably assist and refer patients for it, and that you will have to strive for excellence on this machine. And that's precisely what we hope to aim for in Durbanville. Thank you.